All right.
Hey everybody, this is Dan in the emergency department. Just want to introduce to you a new pain medication we have for our pediatric patients. Intranasal fentanyl is a great new medication for our young patients. It is non-invasive and it's very effective. We're going to be using it in our patients from age 3, patients who need it from 3 to 18 years old, minimum weight of 10 kilograms. All right, so I want to introduce you today how the new medication is used, indications, contraindications. The actual drawing up and administration will be done by nursing. They're all being instructed on this, but because it is a new medication, I want to make sure all of you know how to use it, just in the case that you might need to administer it or help out. All right? So basically, it's a great medication to use for our kids who are in a lot of pain, long bone fractures, burns, big lacerations. Things to look out for, contraindications would be if a kid is very altered, if a kid has hypersensitivity to fentanyl, or if the bilateral nares are occluded. Also, if there's a nosebleed. When you order the medication, it'll be in an order set in the computer. It'll be very clearly delineated. It will come in a kit like this that has a very cute bear on it. Here are the contents of the kit. Paper on how to administer the medication, the pre-filled fentanyl syringe itself, as well as the atomizer. All right, so basically the dose is 1.5 micrograms per kilogram. Each syringe is going to have 0.5 mils, or the equivalent of 20 micrograms per syringe. There's an additional 0.1 milliliters included to account for dead space in the atomizer. Okay, so just to give you an example of how this would work, I have my very robust 3-year-old here who weighs 12 kilograms. 12 kilograms times 1.5 micrograms is going to give me a dose of 18 micrograms. Okay, so I'm first going to take off the red cap and then the white cap. All right, I've done the calculation and I need to get rid of a little bit of the solution. Okay, so I now have my required dose of 18 micrograms. Okay, I'm going to place the atomizer on top of the syringe. To actually administer the medication, we're going to have the patient more or less at about 45 degrees. All right. Half of the solution will go in one nostril, half in the other nostril. Okay, so put one hand behind the back of the child's head, the other hand on the syringe, putting it in the nostril, the atomizer in the nostril as much as you can comfortably. You're going to aim the tip actually toward the top of the ear of your patient. So you're going to aim up and a little bit out. Okay, again, administering half the medication in one nostril, out, and then the other half of the medication, the other nostril, again, up and out toward the top of the patient's ear. Okay, things to look out for. Of course, your kiddo will be monitored and will have naloxone will be at the bedside in case that's needed to look for any kind of respiratory suppression. Okay, so if you have any questions, let me know. We can be sending out some information written as well about the order set. Okay, thanks very much.